Meanwhile, the coronavirus can lead to heart disease, liver damage, and seizures, but there's another life-threatening complication that's also linked to this virus. Wish TV News 8 medical reporter Dr. Mary Gillis has more.
Doctors suspect COVID-19 affects nearly all of our body systems, and the evidence to support this continues to grow, specifically when it comes to the brain. Healthcare workers are seeing more and more cases of infected coronavirus patients coming in with blood clots. This is worrisome because a clot can travel to the brain, blocking the necessary oxygen it needs to function, resulting in a stroke. What's more, younger COVID-19 patients with no prior history of stroke are having them. And if not addressed in time, a stroke can lead to heart damage, brain damage, or even death. Dr. Clinton B. Wright from the National Institute of Neurological Disorders and Stroke spoke with Wish TV about the signs and symptoms you could experience when having a stroke.
We do want people to recognize the signs and symptoms of stroke. We have an acronym that we use called FAST, which is really helpful. So F stands for face, somebody who has a droop, sudden droop of one side of their face. The A stands for arm, so you can have the person, lift up both arms, and if one arm is lower than the other and they can't seem to quite get it up there, that could be a sign of a stroke if it happens suddenly.
Other signs include slurred speech, trouble walking, and loss of vision. Wright also adds there is a decline in the number of people coming into hospitals seeking treatment because they fear a COVID-19 infection. And when I talked with Dr. Wright, he wanted to assure people there is no higher risk of getting the coronavirus should they have to visit a health facility. From the studio, this is Wish TV News 8's medical reporter, Dr. Mary Gillis.